On April 1st, Wisconsin's Governor Tony Evers introduced his second package of comprehensive legislative proposals providing coronavirus relief and support for the people of Wisconsin. Included in this second package was increased funding for healthcare providers, housing and utility protections, and back pay for workers who lost unemployment benefits due to that 1 week waiting period that exists. Now, included more specifically in the second set of proposals, and we have a separate video on the first package of proposals the governor sent to the legislature at the end of March. But in the second package of proposals, Governor Evers provides increased funding for Medicaid providers via supplemental payments and rate increases. He establishes a fund to reduce providers' uncompensated care costs, targeting reimbursement for treatment-related costs for uninsured individuals. And he establishes a coronavirus reinsurance program to reduce health insurance premiums. There's also a lot of language about food assistance, meal delivery, utility and rental protections, back payment for lost unemployment insurance benefits, like we mentioned, supplemental payments to childcare providers, expanded heating assistance, earned income tax credit language, and additional support for small businesses and workers. Why the second set of legislative proposals? Well, Governor Tony Evers says what the federal government has passed is a great start, but I'm concerned it does not go nearly far enough. He continues, we need to take aggressive legislative steps here in Wisconsin, not only for the health and safety of our families and workers, but for the state's economy. He says he's calling on the legislature to convene without any further delay to take up these proposals, he says, to support the healthcare providers, essential workers, small businesses, and families. And this last quote is the most important one. Wisconsin can't make any changes. We can't request any of the federal flexibility that other states have requested because our legislature hasn't convened. And we have rules on the books in Wisconsin, thanks to the lame duck session that happened not too long ago, putting dire restrictions on what the Department of Health Services can ask for and what the governor can implement. We need the legislature to convene and approve these proposals. And once they approve it, then we can ask federal permission. It's not even a done deal. We have to ask federal permission to get that approved. Then we can start thinking about some of these implementations in the state of Wisconsin. And we need to move a lot faster. As Governor Tony Evers says, we need to do this without any further delay. It's April, and we've had the coronavirus emergency for a couple weeks now. And so we're losing time. The legislature isn't even close to convening. We needed them to come back to Madison to take up some of these legislative proposals and start providing some relief to the people of Wisconsin. We linked to both of the legislative packages, the first set that happened at the end of March and the April 1st announcement, in the description below.